Hi, it's Dr. Schleifarth, just checking in to see how your child's doing after surgery. I know it's a difficult recovery, and I'm sending this video just to give you some reassurance and some guidance on how to help your child after tonsillectomy. I know that the next 7 to 10 days are going to be difficult. Your child's going to be miserable, not going to want to drink, have a lot of discomfort, but I want you to remember, first of all, that we did this for a reason, and this is going to really help your child in the long run. We just have to get through this miserable week, and hopefully this video will give you some tips and some reassurance on how to do this. So the first thing to remember is that oftentimes the child will do pretty well for the first day or two, and then all of a sudden, sort of out of nowhere, they'll start to struggle. You know, they'll have some discomfort, they won't want to drink, and that typically happens around day 3 or 4. This is normal. Don't think anything's wrong. This is to be expected. This is when you really need to push the fluids, and that's probably the most important thing after tonsillectomy, is that we keep your child hydrated. Make sure that they drink a lot of fluids. And there's lots of ways to do this. You can give them water, Gatorade. You know, everyone loves popsicles and ice cream, but those are really good things that kids typically like, will typically eat, and will help with the recovery process. So staying hydrated is very important. Also important is the pain medication, the pain management. So it's sort of depending on the age of your child. Tylenol and ibuprofen is sort of the mainstay of pain medication or pain management after the surgery. I want to make sure that you stay on this, stay aggressive with this. Give this very frequently. You know, every 2 to 3 hours I want you to give Tylenol. 2 or 3 hours after that, give ibuprofen. And continue that around the clock, so we make sure that your child is always getting some pain medication. Because once we fall behind in the pain medication, once we fall behind on the pain, it's difficult to catch up. The other thing I want to talk to you about is if your kid is really struggling, really having a hard time, I want you to let us know. I want you to keep us posted on how your child's doing. Because we deal with this often. We have lots of tricks that we can share with you. So please call our office and let us know if he's really struggling. The other thing I want to talk to you about is bleeding. I know we talked about this in the preoperative setting, but bleeding, while very, very rare, can happen. And when it does happen, it's scary. It's scary to the child, it'll be scary to you. So I want to tell you what to do and what to look for if your child does have a bleeding episode. So first of all, you'll know if he or she is bleeding. There's no questioning. If you're questioning whether or not she's bleeding, then your child is not bleeding. It's very obvious. And if they are bleeding, the best thing to do is to get some ice cold water, or maybe have them suck on an ice cube and just hold it in their mouth for a couple seconds, spit it out, do that again, hold it in their mouth for a couple seconds, spit it out. Do this for about 5-10 minutes. If your child is still bleeding, I want you to call us. I want you to call us right away, call us right at the office, and I'll get right back to you. You can call on the weekends, you can call on the holidays. We'll get right back to you and we'll come up with a plan. Again, it's very unlikely, but it's nice to have a plan. So anyways, I hope this video helps you, gives you some reassurance that you and your child will make it through this, and in the end, your child will be so much better for having the tonsils out. Please don't hesitate to call us. We're here to help you. We're here to help your child.